Hello everyone, and welcome to the Old Fashioned Health Network. I'm Gwen McDaniel, your host for the Senior Living Show. And we have as our guest today, Dr. Caleb Norman. Welcome.
Thank you. How are you?
I'm doing extremely well, and I'm so happy to have you with us. Dr. Norman is actually a licensed physical therapist, and you're practicing in Atlanta since last year, 2015. He completed his undergraduate work at the University of West Alabama. And I understand that you graduated from Alabama State University.
That's correct. And
got your clinical doctorate degree in physical therapy. So that's really exciting. You look so young. I'm surprised. But you know, the thing that is interesting is I also understand that you do dry needling. And
yes, that's another certification that I got about a year ago. It's a kind of a spin-off of acupuncture, but it's a physical therapy way of going about dry needling.
Well, so, that's exciting. We'll have a chance to listen to some of your information on that. But I'm excited to hear that you're native of Louisiana, not far from Mississippi, which is where I am. That in your work as a physical therapist, you actually get to work with people of all ages.
Yes.
And that's one of the reasons that we invited you here today, because we basically cater a lot of our information to seniors.
Okay.
And there are plenty of times that we need a physical therapist. But you know, so often we don't know when your occupation could really help us. So we want to talk today about how what you do can help us and not have to totally rely on a doctor referring us to a physical therapist, but knowing when our body actually needs that assistance. The first thing, and that is, what is physical therapy, and why did you choose this area of work to go into?
Well, that's a great question. I think a lot of people aren't well versed about what physical therapy is. But physical therapy is a non-surgical conservative treatment based on evidence, scientific data, research, and it's for injury prevention. It's to promote movement, promote mobility. It's to reduce pain, which is one of the major reasons people go to physical therapy. And it's just for overall health benefits that we're more of an advocate as well for healthy lifestyle, prevention, just doing what you need to do and trying to avoid having to need physical therapy.
So what are some reasons that usually you will see seniors and have to be able to give support to seniors these days?
Well, fall risk is the major reason when it comes to the senior population. Now that encompasses a whole lot of things. Fall risk can be it can be balance issues. Poor balance is a major reason why patients, clients end up falling, and muscle weakness. It can be depression. Depression has a lot to do with that as well. Poor medication is a big thing. A lot of times we, doesn't have to be seniors, don't take our medicine as we should. You could be taking more or less or not what you need to be, and it can have instances where it causes you to lose your balance or to not think correctly and not be as safe as you can in your home or in the community. It could be for replacements after surgeries. We do a lot of rehabilitation after surgeries. And just if you have hospital stays, extended hospital stays is a general deconditioning of the body. So just getting you back to being acclimated to being as strong as you were before you went into the hospital, to be safe in your home. So that's some of the reasons that physical therapy can be important for seniors.
And I've personally experienced some friends now that the younger baby boomers, we don't know that we've gotten older. So you got a lot of them still playing basketball that have the knee injuries. They forget that they their body has changed.
I say all the time, I always have a job because people are always working out and doing some things they shouldn't be doing.
So now, what are some of the methods that you use in your practice?
Okay, well, the most common method is what we call therapeutic exercise and activity. So that's your traditional, probably what most people think about physical therapy, whereas it be weight training, stretching, just doing physical activities. We call that therapeutic exercise and activities. Therapists also utilize modalities. We call modalities like ultrasound, electrical stimulation, heat, ice, all kind of different radiation type waves and therapies like that to promote healing and reduce pain in different type of ways. Manual therapy is a big thing. That's more specific for case by case and specific diagnosis. Basically, you have the therapist will have hand placement on the structures of the body to promote movement, range of motion, and reduce pain for joints and muscle pain, things like that. And other things, other certifications, kind of like you mentioned earlier, the dry needling. That's another thing that some therapists have certification in, and the dry needling, just like a little brief, it's just to kind of increase healing into certain areas and to help with like muscle release, muscle tension, and to reduce pain as well. But that's another segment that we'll do later on to get more in depth on the dry needling.
I tell you, the muscle tension is a big area, and most of us will have it either across our shoulders or in our back, and for various reasons in the legs. So that's a huge
back
area
is a
for
big
us.
thing.
Yeah. Well, listen, let's take a break for a moment, and we'll come back and talk a little bit about some other topics that you're going to bring to your audience.
Okay.
And we look forward to hearing from that. So we'll take a quick break.
Welcome to Baked, located in the heart of the Old Fourth Ward in Atlanta, 480 John Wesley Dobbs Avenue. While the name of the restaurant is Baked, we also fry and saute like nobody's business. Special attention is given to 12 menu items, 7 of which are gluten-free. Welcome to Baked.
Welcome back, everyone. Well, before the break, Dr. Norman and I were talking about methods that he uses, and we afterwards talked about why you do what you do. What kind of got you into, I would say got you into this lane, but what got you into physical therapy?
Well, just growing up, I played basketball through high school and into college as well. And just being around, luckily I've never had a major injury, but just being around the training room and seeing some patients and families going through physical therapy, I was pretty much versed, and I actually got to shadow some physical therapists that kind of pushed me into the setting as well. And even some of my family and friends growing up were physical therapists as well. So just seeing the profession and seeing family and friends enjoying what they do just kind of pushed me towards that way.
That is so interesting because we oftentimes think about the environment for our kids. And often it's the surroundings, it's what you're exposed to that helps to cultivate our interest in different things. So that's extremely important. But I love the fact that you picked up on that as a child and it followed through as a dream for you.
Definitely.
And here you are living your dream. Isn't that awesome? Well, I understand, Dr. Norman, that you're going to be joining us at the Old Fashioned Network.
I will. Yes.
And that's exciting because we really are always looking for great information so that we can share it with our audience. So what are some of the things that you're going to talk about in the future in different programs that you can bring to everyone?
Well, I'm excited to be a part of the program, and so I'll try to start off again kind of telling people, educating people on more specifically what physical therapists do and how we can help people of all populations, all ages. I like to try to get into common injuries, whether it be from the foot to the head that we go through, and even make it more current events, things that's going on in the news, or new studies that come out for the Physical Therapy Association, and try to just keep the audience versed on what's new and what's going on. I like to get into neurological conditions that may cause physical impairments, whether that be strokes, Parkinson's, multiple sclerosis, all kind of different neurological conditions that people have that actually people might not think is very common, but it is. And also try to keep it diverse. We can talk about some sports. I can even get into pediatrics and just overall health and wellness and prevention as well.
That's great. Well, you heard it from Dr. Norman. He is going to have just a series of some fantastic programs coming for you. So we want you to come back and look up his show on the Old Fashioned Health Network. And one thing we always say here, Dr. Norman, we have good health inside and out. So we hope you have a fantastic day. Thank you so much. It was my pleasure for meeting you, and I look forward to seeing some of the exciting things that you're going to bring to the network.
Thank you. I enjoyed it.
Great.